father died of pancreatic cancer when he was too young, 77, otherwise healthy. So when an opportunity came to participate in a pancreatic cancer research team, I said, we're in. We consider ourselves a crucial element in the fight against cancer, though we are not medical doctors and we're not laboratory scientists. We're the data people. So our core mission has to do with clinical trials for cancer patients or prevention trials. And our job in that mission is to make sure we get the data right and arrive at the right answer.
So we work very closely with the doctors, with the physicians, and we make sure in our discussions to really distill the scientific answers that are important and to make sure that in our statistical design, at the end of the day, at the end of the study, we can answer those questions. We will know, does the new treatment, does it work better than the previous treatment? Is it more efficacious? Are there serious adverse event side effects we should be aware of? So we make sure that our study is designed properly. And that's really what we do here at CRAB, and that's what we do really well.
I think that people do have that idea that it is just data, but every piece of data for those of us that work in data management, it represents a person. It represents looking at their information and saying they've contributed. This person had a side effect that made them lose their hair, and they did that for science. They did that to help maybe not themselves, but the next person. And we look at all that and we see not just a piece of paper, but a person and a contribution.
You can't live without knowing somebody that has cancer. It drives our activities every day. I don't think that there's anybody in the company that hasn't been touched by cancer.
My father suffered lung cancer, passed away when I was a boy.
3 months into my employment here, my mother was diagnosed with stage 4 pancreatic cancer.
It's touching to work for a nonprofit cancer research institute such as CRAB, in the sense that I can at least aid, in whatever small, meager portion, the destruction of a nasty disease, at least in the industrialized world, here in America especially. So,
technology at CRAB supports the science of cancer research.
In the past, people collected data in paper form. We were one of the first groups to put it all in a computer system, do electronic data capture. And by doing so, we've now amassed such a large collection of data across so many clinical trials that we can ask questions that you never could have asked before on paper. It just makes all the difference.
We maintain 150 servers and network devices with 60 terabytes of data storage capacity. We maintain that data in a secure way so that we can maintain its integrity.
So we bring the tools that we have to this fight. Those tools are biostatistical methods, data management methods, an attention to detail, a passion for getting the truth.
And we are relentless, just like what we're fighting against. We keep coming. We are not going to stop.
Every person in this organization is proud to work in the fight against cancer.
My aunt, my mother's younger sister.
My grandfather.
I've grieved with a friend who lost her son to leukemia.
I have a father-in-law who died of lung cancer, a husband who had throat cancer, and I was diagnosed with benign thyroid tumors when I was 18.
Here at CRAB, I've been taken by the integrity of the individuals here and by recruiting the efforts of greater society to join us. Maybe we can beat cancer.